Yes, I had a young lady tell me that today. I'm not from here. First of all, I do want to say, to the chairman here, Ron, and the board of trustees, and to the president here and Dean, I do appreciate this invitation to come to speak here today. And really, on a point of more of a personal note, Dr. Alexander and I served on the AOA board for a number of years, and I actually heard about this building for many years also. And by the way, can I go by and see Penny Hall? I have to go see it. I've heard so much about it here today. But I'm very proud when I got the invitation to come to the building dedication. I had heard Kevin over many conversations and refreshments over a period of years talk about this building, and I wanted to be here to see his thoughts and all the many people who worked on this facility for a number of years. So I want to send congratulations from the American Optometry Association and all optometrists across this country about this facility you've had here today. There's been a little bit of talk about the past, and I've heard of things talk about the future. I want to tell you some things that you may not think about here in your facility today, in this celebration today, how really important this facility is going to be in the education of optometrists in the future. I got to do the commencement speech at Southern College of Optometry, where I attended optometry school. And it was pretty interesting. It was actually 25 years, nearly to the day, that I was giving the commencement speech, and I was sitting out in the audience ready to graduate. And I thought about how much optometry had changed in the last 25 years of my career, and more importantly, in the last 5 years, how much technology has changed optometry. And I also realized at that time, as you get older, you have realization points that you think about and say, I really need to take time to recognize this. And what I recognized at that commencement celebration at that day was the fact that my education I had at Southern College of Optometry had carried me through my profession and all those changes we had seen out there. And I would submit to y'all today, y'all from the South here, I would submit to you today that in fact the optometric education is going to be even more critical in the future for our future optometrists. And I'll tell you why. Number one, look at all the information coming out when we unsolve the genetic code, all the treatments that are going to come from that. Also, look at technology. As I mentioned a while ago, how much practicing optometrists know, how much has your technology changed in the last 5 years? Who knew what OCT was? Who knew what Avastin was? You didn't know that 5 years ago. So we're just at the brink of having more and more technology changes out there in the future. And then number three out there is the health information exchange. In the future, optometry will be on the front line of healthcare, not just in eye care, but in healthcare. Helping with diabetics, helping with people with hypertension. We're going to be tied into the electronic healthcare network of your state and also this nation. And hopefully we can come to some solutions to the healthcare crisis we have in this country today. So again, I would submit to you that the optometric education, that this fine facility here will accommodate the structure and to carry our optometric students in the future. And I also think with the healthcare situation we have today, that in fact never before has the U.S. healthcare system needed optometry more than today, because of the fact they do work with people with systemic diseases, that type of thing. So I would say to you that looking forward to the healthcare reform coming up out there, this is going to be the biggest challenge that our profession has ever faced. There's new terms out there: value-based healthcare purchasing, health information exchanges. All these terms, we really don't know what they are, but we're going to have to learn and have a better healthcare system in this country. With our national debt we have and the amount of dollars spent in this healthcare system of the United States, nearly 20% of our economy is spent on healthcare. We're going to have some solutions. And I would say today that this institution here can be a part of those solutions out there. But I'd also say to you today that this healthcare reform that this country must undertake in the near future, in the next couple of decades, is optometry's greatest opportunity. In fact, we're going to have more people who will be Medicare age, more people with aging eye conditions out there. There are going to be more people on Medicaid through this reform. There's actually going to be nearly 50 million people who are uninsured currently in this country today that might have insurance in the future that will have access to the healthcare system. So again, we have many opportunities out there in optometry. So again, I ask you today, who's going to step up and provide the primary eye care needs for this country? I say it's going to be optometry. Who's going to step up and provide the health care, be part of the health care team in this country down to the local level, and that's the primary care level? Who's going to step up to that? And I say optometry can be the one. So I say to the Board of Trustees, to Ferris State, the Dean, the President, that in fact Michigan College of Optometry can step up and provide those primary eye care needs for this country, and more importantly, establish the education foundation that will carry the future doctors of optometry into these many changes that we're going to see in the healthcare system in the future. So I ask you today as the Board of Trustees and the President of this college here to continue your vision in the future that you've outlined, and that's to continue to promote excellence, leadership, and innovation in optometric education. Thank you very much.